Older women. 7 hidden causes of dizziness and balance problems you shouldn't ignore. Why are so many older women losing their balance? It starts slowly. Maybe you stood up too fast and felt lightheaded. Maybe you missed a step or stumbled while walking on flat ground. At first you brush it off. I'm just tired, you say. But deep down something feels different. You're not alone. In fact, studies show that nearly 1 in 3 women over the age of 65 will experience a fall each year, and many of these falls are caused by dizziness or sudden loss of balance. Even more concerning? These falls are the leading cause of injury in older adults. But here's what most people don't realize. This loss of balance isn't just a part of getting older. It often comes from silent, fixable issues hiding in your daily routine or health. In today's video, we're going to uncover 7 hidden causes of dizziness and balance problems that affect millions of older women, and how you can recognize and avoid them before it's too late. Let's begin. 1. Inner ear issues, the silent saboteur of stability. You might think your ears are only for hearing, but they actually play a critical role in balance. Inside your inner ear is a tiny, complex system called the vestibular system, like your body's own built-in level and compass. It constantly sends signals to your brain about your head's position and movement. But when something disrupts this system, such as an inner ear infection, fluid buildup, or a condition like benign paroxysmal positional vertigo, BPPV, your brain gets confused signals. That's when the room might suddenly spin, or you feel dizzy when you turn your head or get out of bed. These inner ear imbalances are one of the most common causes of dizziness and balance loss in older women, yet they often go undiagnosed. Some women describe it as feeling like the floor is shifting beneath them, even though they're standing still. The good news? Many vestibular issues are treatable, with exercises, medications, or specific therapies like the Epley maneuver. If you've been feeling dizzy or off balance, especially when moving your head or changing positions, it might not be just old age. It could be your inner ear sending the wrong signals, and it's something worth getting checked. 2. Medication side effects, the hidden cause you didn't suspect. As we age, most of us start taking more medications, for blood pressure, diabetes, cholesterol, sleep, or even mood. But here's something many don't realize. Some of these medications can directly affect your balance. In fact, dizziness and lightheadedness are among the most commonly overlooked side effects of many everyday prescriptions. Take blood pressure medications for example. They can lower your blood pressure too much, especially when you stand up quickly, causing a condition called orthostatic hypotension, which makes you feel faint or wobbly. Sedatives, sleep aids, and anti-anxiety medications like benzodiazepines slow down brain activity, which may leave you feeling groggy, confused, and off balance. Even certain antidepressants and painkillers, particularly opioids, can cause dizziness or unsteady movement, especially in older women whose bodies metabolize drugs differently with age. And the more medications you're taking, the higher the risk, because some drug combinations interact in ways that amplify balance problems. This is why it's so important to review your medications regularly with your doctor or pharmacist, especially if you've been feeling dizzy, tired, or off lately. What seems like a minor side effect could actually be putting you at serious risk for falls, and simply adjusting your medication could bring you back to feeling steady and confident again. 3. Low blood pressure, when standing up feels like falling down. Have you ever stood up too quickly, and suddenly the world feels like it's tilting? Your vision blurs, your head feels light, and for a second, you're not sure if you'll stay standing. This isn't just fatigue. It could be a condition called orthostatic hypotension, a sudden drop in blood pressure when you move from sitting or lying down to standing. And it's alarmingly common in older women. As we age, our bodies become slower at adjusting blood pressure in response to position changes. Instead of sending enough blood to the brain when you stand, your pressure drops, and you feel dizzy, weak, or like you might faint. It's not just uncomfortable, it's dangerous. Many falls in older adults happen within seconds of standing up, especially at night or early morning. Low blood pressure can be caused by certain medications like diuretics or heart drugs, dehydration, prolonged bed rest, underlying health conditions like Parkinson's or diabetes. What makes orthostatic hypotension tricky is that it can be intermittent. You might feel fine one moment and suddenly off balance the next. If you've experienced lightheadedness when rising, or you've had unexplained falls, don't ignore it. Simple lifestyle changes, like rising slowly, staying hydrated, or adjusting medications, can often make a big difference. And remember, dizziness isn't just aging. It's a message from your body, and it might be telling you something important. For age-related muscle weakness, strength that slowly slips away. You may not notice it right away, The stairs feel just a little steeper. The grocery bags seem heavier. And getting up from a chair takes more effort than it used to. This slow decline isn't in your head, it's happening in your muscles. It's called age-related muscle loss or sarcopenia, and it affects nearly every older adult, especially women after menopause. As we age, our muscle mass naturally decreases, starting as early as our 40s, and by the time we reach our 70s or 80s, we may have lost up to 30% of our strength. That loss doesn't just make daily tasks harder, it directly affects balance and stability. We rely on strong leg, core, and back muscles to keep ourselves upright, adjust our posture, and respond quickly if we stumble. But when those muscles weaken, our body becomes slower to react, and a simple misstep can turn into a dangerous fall. To make matters more difficult, many older women also experience joint stiffness from arthritis, less physical activity due to pain or fear of falling, and even nutritional deficiencies that make muscles weaker. This decline is one of the key age-related changes in the elderly that most people ignore, until they find themselves reaching for walls or furniture just to feel steady. The good news? Muscle loss isn't completely out of your control. Strength-building exercises, gentle movement routines, and proper nutrition can help maintain or even rebuild muscle, no matter your age. The sooner you start, the stronger you'll stay. Your body just isn't listening the way it used to? You know where you want to step, but your feet don't move quite fast enough. You react, but just a moment too late. That split-second delay can be the difference between catching yourself and falling. This disconnect often stems from neurological changes that happen with age. Your brain is the command center of balance. It constantly gathers information from your eyes, ears, muscles, and joints, and sends signals back to your body to help you stay upright. But as we get older, this brain-body communication slows down. Tiny delays in signal processing, weakened reflexes, or subtle changes in cognitive function can cause slower reaction times, delayed muscle responses, trouble concentrating on walking while talking or multitasking, and difficulty adjusting to uneven surfaces or unexpected changes. In some cases, balance problems may be early signs of neurological conditions like Parkinson's disease, peripheral neuropathy, or even mild cognitive impairment. Even without a serious diagnosis, the aging brain can simply become less efficient at keeping up with all the demands of movement, focus, and coordination. This is why it's so important to stay mentally and physically active. Activities like walking, dancing, tai chi, and brain games don't just keep your body in shape, they keep your brain sharp and responsive too. Because when the brain and body stay connected, balance becomes more than possible, it becomes natural again. 7. Poor footwear and home hazards, external triggers you can fix. Sometimes, the cause of losing balance isn't deep inside your body. It's right under your feet or hidden in your home. Let's start with footwear. Many older women wear shoes that are stylish, easy to slip on, or just familiar, but not supportive. Flat soles, worn-out tread, or loose-fitting slippers can all contribute to unsteady walking. Without proper grip, arch support, or heel cushioning, even a confident stride can quickly turn into a dangerous misstep. Then there's the home environment, the place where most seniors actually fall. You might not even notice the risks around you, but things like loose rugs, poor lighting, cluttered walkways, slippery bathroom floors, and uneven surfaces all increase the chances of losing your balance, especially when you're tired, distracted, or walking at night. And don't forget, as vision, muscle strength, and reaction time decline with age, these small hazards become big dangers. But here's the good news. These are external triggers you can actually control. Choose well-fitting shoes with non-slip soles and strong arch support. Install grab bars in the bathroom and night lights in hallways. Clear floor space and tape down loose rugs. Use non-slip mats in the shower. And if needed, don't hesitate to use a cane or walker. They're tools of independence, not weakness. Preventing loss of balance while walking often starts with simple choices. You don't have to change your body to stay safe. Sometimes you just need to change your surroundings. When to see a doctor, don't ignore these warning signs. Some people chalk up dizziness and balance issues to just getting older. But losing your balance isn't normal, and it's definitely not something you should ignore. In fact, it's often a warning sign. If you or someone you care for is experiencing frequent dizziness or lightheadedness, a feeling of unsteadiness when walking, sudden, unexplained falls, numbness or tingling in the feet, trouble focusing or feeling confused while moving, or a fear of walking without support, it's time to speak with a doctor. These could be early signs of underlying issues, from medication side effects, vitamin deficiencies, inner ear problems, or even neurological changes. And the sooner these problems are addressed, the easier they are to manage or reverse. Caretakers, don't wait for a fall to happen. Start the conversation now. Ask questions. Take notes. Be an advocate. Because when it comes to balance, early action can mean the difference between independence and injury. You deserve to feel confident and steady with every step you take, and it all starts by not ignoring the signs. On one foot for 10 seconds. Heel to toe walking in a straight line. Practicing getting up from a chair without using your hands. These can retrain your body to stay steady, even on uneven ground. Small blue diamond 3. Strengthen your core and legs. Focus on low-impact strength training using resistance bands, light weights, or even bodyweight exercises. Strong leg and abdominal muscles mean more support and fewer falls. Small blue diamond 4. Check your vision and hearing regularly. Balance relies heavily on what you see and hear. Regular eye exams and hearing checks can identify small issues before they lead to dangerous stumbles. Small blue diamond 5. Review your medications annually. Ask your doctor or pharmacist for a medication review, especially if you're on multiple prescriptions. Some side effects sneak up slowly and directly affect balance. Small blue diamond 6. Stay hydrated and nourished. Dehydration and vitamin deficiencies, especially vitamin D, B12, and iron, can cause dizziness or fatigue. Eat a balanced diet and talk to your doctor about supplements if needed. Small blue diamond 7. Fall-proof your home. Make your space safer. Add non-slip mats and grab bars. Remove tripping hazards. Use night lights to prevent accidents in the dark. And wear supportive shoes indoors, not socks or loose slippers. Small blue diamond 8. Don't ignore fear. Many older women reduce activity out of fear of falling, but that actually increases fall risk. If fear is holding you back, consider a balanced therapist or occupational therapist to guide you in a safe, encouraging way. Better balance for seniors isn't a myth, it's a method. With a few small changes in your daily routine, you can regain control, move with more confidence, and enjoy life more fully, step by steady step. Reclaim your balance, reclaim your life. If you've made it this far, remember this. Losing balance isn't a sign of weakness, it's a signal. A signal that your body needs attention, care, and maybe a few small changes. But the good news is you're not powerless. With the right steps, you can move through your home and your life with more strength, more stability, and more peace of mind. So if you found this video helpful, don't keep it to yourself. White heavy checkmark like the video to let YouTube know this topic matters. White heavy checkmark subscribe to Wisdom and Stillness for more honest, gentle, and life-improving advice for older adults. White heavy checkmark and share this with someone you love, because one small tip could help prevent one big fall. We're here to support your journey, not just to live longer but to live better. Until next time, stay steady, stay